These are exciting times for multiple myeloma, and that excitement has carried through here at ASCO. I would say several developments have come through ASCO this year, and I'll summarize them with three of them. The first is the greater infiltration of monoclonal antibodies. In fact, we had a plenary session dedicated to myeloma, which is a rare event here at ASCO, where Dr. Antonio Palumbo from Italy presented the results of the CASTOR study, which compared Daratumumab, Bortezomib Dexamethasone versus Bortezomib Dexamethasone. And as expected in this relapsed population, most patients had had only one or two prior lines. There was a dramatic improvement in the progression-free survival of patients who had a monoclonal antibody added to the Bortezomib. I think this is particularly important because right now this agent is approved as monotherapy and approved later in the disease course. And this study validates what we've all believed in our hearts, that monoclonal antibodies will ultimately be brought earlier in the disease course and will be used in combination. One of the most important things of this study was that the added adverse events in the study arm from the addition of Daratumumab were almost nil, apart from infusional reactions, which we've learned to control. So that non-overlapping toxicity of a monoclonal antibody is very desirable. And for those who are going to be going to the European Hematology Association later this week, we will have yet another presentation very similar to this one, which is going to demonstrate the difference between lenalidomide dexamethasone and Daratumumab lenalidomide dexamethasone, again showing a great difference. The last comment I'd make about monoclonal antibodies is that we saw the up-and-comer Isatuximab, which is also a CD38 monoclonal antibody, being developed and showing tremendous single-agent activity and also activity with lenalidomide. Much more to say about monoclonal antibodies, but I would say that's the biggest highlight of ASCO myeloma this year. The second area that I think is of note is the greater introduction of oral proteasome inhibitors in the disease course of myeloma. Ixazomib was FDA approved in the US late last year to be used in combination with lenalidomide in relapsed disease, but we saw different abstracts presented this year using this drug up front in patients. Very attractive being an oral agent to allow people to have an all-oral regimen, such as Ixazomib lenalidomide dexamethasone and Ixazomib cyclophosphamide dexamethasone, showing great response rates and very manageable toxicities. So I suspect in particular in the older population, this is going to be very valuable to us to be able to provide them a combination of a proteasome inhibitor and another agent in an all-oral combination. The third major development I would say that was particularly important here at ASCO was the validation of autologous stem cell transplant. And we joke that sometimes transplanters always want to talk about transplant, and I'm partly a transplanter, so I want to be careful. But we wondered with the dawn of these novel agents if transplant would fall away. But we had yet another study demonstrating to us the role of autologous stem cell transplant in adding further depth of response to patients treated with novel agents. So for eligible patients, they're still present. And still on that transplant theme, perhaps the last abstract I should mention was Dr. McCarthy's meta-analysis of maintenance lenalidomide. This is something we've been using quite routinely, but in this meta-analysis of trials that had used lenalidomide post-transplant, they demonstrated an overall survival benefit of approximately 2.5 years of those patients receiving lenalidomide in their maintenance strategy as opposed to placebo. So I think it'll further enhance our use of maintenance therapy in myeloma.